Like many pain conditions, chronic fatigue syndrome has no true cause and remains difficult to treat. It's characterized by extreme fatigue that's unexplainable by any known medical condition. Over the next few weeks, we hope to shed light on chronic fatigue syndrome by bringing in a very special guest. Laura Jane runs her own YouTube channel, aptly named Laura Jane, Laughter, Lifestyle, and Creative Musings. She has over 1,100 subscribers on YouTube and is a chronic pain patient that struggles from chronic fatigue syndrome. I encourage each and every one of you to subscribe to her channel by clicking the link below. Laura, welcome to the show.
Hello.
Now, Laura, why don't you go ahead and tell our audience who you are, where you're from, and what your initial symptoms were when you found out about your chronic fatigue syndrome.
Well, my name is Laura and I am from a very small town in New Zealand. I was diagnosed with chronic fatigue, oh gosh, it must have been like 2 years ago, 2.5, coming up 3 years ago now. And it started out as complications from glandular fever. So I got glandular fever at the beginning of 2012 and when you have glandular fever you kind of get really tired and as you're healing, I guess, but my tiredness just never really went away and I used to fall asleep whilst driving back from work and I'd be really tired. I wasn't making it to work at all. I'd lose my appetite and I just wasn't a very cheery person to be around because all I really wanted to do was sleep.
When did you decide to seek help and what were your initial answers when you sought help?
I went to the doctor and just simply told him I was tired all the time and I didn't know what was going on. And his first thought was, oh well, it's probably just some complication from glandular fever, but we'll test you for A, B, C, D. So I had a ton of blood tests done and they all came up clean and they were monitoring my blood quite often, which was really good. And my doctor just simply told me you need to quit work and you need to spend some time just recovering and focusing on yourself because you're putting yourself in a more dangerous position by continuing to work and fall asleep whilst driving and making yourself more and more exhausted.
Were you satisfied with these answers or did you seek more? And if you sought more, where did you find those answers?
Well, I did obviously, the first thing I did was go online and kind of look up what chronic fatigue was, but you couldn't really get sort of a thorough answer because everybody was different and everybody had them for different reasons, or it was a side effect or a symptom of something else. Nobody really knew what it was and why people had it, and it's kind of frustrating to have something like that when you can't really find out more information.
Describe your support system. How did you find support? And who supported you?
Well, I had a really great family. I live with my parents. I had to move back in with my parents and they've been very supportive, just helping me out, pushing me to find answers and just providing a great environment to live in and not have to stress and worry about paying bills all the time. At the time I had a partner who was very nice and very kind and he completely understood, which was really nice to have that moral support there because otherwise you could feel very lonely, and I can understand how people would fall into depression a lot just because you are by yourself all the time because you're not capable of being able to go out and hang out with friends or go out and walk around. It was very difficult explaining it to my friends and I feel like they didn't quite understand because I was, I don't know, 20 at the time and everybody wanted to go out drinking into bars and things like that, and it was quite hard for me to explain that I can't, like I don't know why, but I just cannot cope with it. Like I can't, I'm too tired all the time. But most people were very kind and understanding and I didn't really lose any friendships or anything over that. And then financially, I had to use all my savings that I was saving up for travelling and I burnt through all that. Financially, I had to apply for a sickness benefit that was available here in New Zealand.
Thanks, Laura, for those insightful answers. We'll touch base again next week.
Thanks!
We hope you enjoyed today's chat with Laura Jane. Please be sure to subscribe to her channel by clicking the link below, and also be sure to tune in next week for part 2 of our 3-part series on chronic fatigue syndrome, where Laura and I will talk about her life with CFS and how she was able to find relief and fight through her struggle. And that's another dose of pain news brought to you by PainDoctor.com. For more information and stories about chronic pain, subscribe to our YouTube channel, follow us on Twitter, and like us on Facebook. Thanks, and have a pain-free tomorrow.